Joining us to discuss is Dr. Rossi Hassad, epidemiologist and statistician. Doctor, this is a change from what the CDC originally said. What do you think led to this decision?
I have a mixed position on this new policy. I think on the one hand, we need to address the shortage of essential workers, particularly healthcare workers. But on the other hand, we need to recognize that all exposures are not the same. There are minor exposures and major exposures in terms of the amount of viral load that an exposure might impart, and therefore the level of risk that a contact might be in terms of developing disease and serious disease. So what I would like to see is a more careful monitoring of those who have had a major exposure, such as monitoring them for at least the median duration for incubation up to about 3 to 5 days, and then having a test, a COVID test before they return to work.
All right, that's interesting. We're all waiting for, certain tests to be coming out in general to see if we've been infected and would have the antibodies against it. Doctor, I want to talk to you about this as well. We're seeing certain areas that have been overwhelmed with patients trying to get into the hospital. What determines, specifically in New York City, whether certain people are admitted or others are told to wait it out at home and, maybe treat it with over-the-counter medication?
Well, it depends on the level of symptoms that you have, the severity of your symptoms. Currently, you're being advised that if your symptoms are mild enough that they can be managed at home, you should not be visiting an outlet. You should not be at a hospital or clinic. And this is particularly important because you may be at a higher risk of exposure visiting a hospital, and your symptoms may not be COVID-19. So we want people to remain at home if they have symptoms, monitor their symptoms for 3 to 5 days. If they do not resolve, contact their healthcare provider. But going to an outside clinic or hospital can put you at significant risk of infection if you are not infected.
All right, that's some good advice there. The FDA, meantime, has approved a commonly used sulfate-based inhaler, catering to the increased demand of COVID-19 patients suffering breathing difficulties. So, doctor, what exactly does the infection to patients do to patients' lungs, and would this specific inhaler be beneficial here?
This is a commendable move by the FDA because this is albuterol, which is a commonly used drug for highly prevalent lung conditions such as asthma and other airway diseases. And lung disease is a primary underlying condition for COVID-19 that can lead to serious disease. So keeping your asthma or other lung disease control is very critical at this time. So this is an amazing move and much needed because that's the primary organ that COVID-19 attacks, the lungs.
Yes, we've heard that. So any sort of situation that could help alleviate those symptoms would be ideal. Doctor, one quick question for you. We've heard potentially that this virus could either go away or somewhat reduce as the weather gets warmer, as we head towards the summer. Care to comment on that?
Well, we're all hoping that this virus will behave like other viruses, respiratory viruses, and abate in the summer. But I think the evidence so far is mixed on that, and that's not a strategy that we can hope for. So it's very important that we continue our social distancing and other protective measures.
Okay. All right. As we wait for this to completely turn around, we will continue to social distance from one another. That's Dr. Rossi Hassad, epidemiologist and statistician. Doctor, thank you for joining us.